A new health concern amid the COVID-19 pandemic. The risk of diabetes in children has increased for those diagnosed with COVID-19. The Centers for Disease Control and Prevention is out with a new study that looked at more than 500,000 kids with COVID and compared them with children who'd never had it. Western Mass News reporter Kristen Brunell getting answers from a local pediatrician to find out what parents need to be aware of.
The study was shown that there's an association of increased risk for diabetes in children under age 18 after a COVID infection.
A new study conducted by the Centers for Disease Control and Prevention has found a possible link between COVID-19 and an increased risk of diabetes in children. Western Mass News spoke with local pediatrician Dr. John Kelly of Redwood Pediatric and Adolescent Medicine to find out what people should be aware of.
And it's important to emphasize that it's an association, it's not a causality. It doesn't mean that COVID's causing diabetes. That's not been determined at all.
According to the CDC, the study looked at databases with information for over 2.5 million patients under 18. They found that children diagnosed with COVID-19 were about 2.5 times more likely to receive a new diabetes diagnosis. Dr. Kelly says this new research is something to be aware of, but nothing to be overly concerned about. He notes that parents should be paying attention to warning signs of diabetes in children.
Increased thirst, increased hunger, unexplained weight loss, increased urination to the point where the child's getting up multiple times a night. Those are all signs, even before COVID, of signs and warnings of diabetes.
Just last week, 580,000 children tested positive for COVID-19, according to a weekly report from the American Academy of Pediatrics and the Children's Hospital Association. Dr. Kelly says the best advice for concerned parents is to get their children vaccinated against COVID-19.
What does this mean? What should be an action point that we should all take based upon this data? And the action point is please get vaccinated.
Dr. Kelly is also continuing to conduct heart screenings for children 12 years and older who had COVID-19 before they returned to sports. But he stresses they are only screening for very rare complications.
We only need to screen for folks who had prolonged symptoms. Certainly one is more than 4 days of fever. Certainly anyone that was admitted to the hospital, and certainly anyone that was in the ICU. Before they can resume sports, they absolutely have to be cleared from a cardiovascular standpoint.
Reporting in East Longmeadow, Kristen Brunell, Western Mass News.